kule summer ngisazogcoka i-cap njengoba ningibona ngigcoka i-cap skin sami zosiprotecta vele ngokugcoka nje i-cap khona nento engigcobisayo for sunscreen engigcobisayo for skin sami.
Just applying a bit of aloe vera from Clicks and also using Dove soap at night as a normal routine, and then also applying some moisture to moisturize my skin, obviously, to keep it hydrated, and drink plenty of water.
There's nothing I necessarily do. I just live as I am because my skin does not have a problem. I just drink a lot of water.
I'm using Vaseline to protect my skin.
For my face, I use sunscreen. Nothing else but sunscreen and wearing big hats. Yeah, that's all.
What causes skin cancer? What are the signs and symptoms of skin cancer? And what skin cancer treatment options are available? Hello and welcome. I'm your host, Dr. Musa Mtombeni, and signing with us is Samora Mbuyaze, and the feeder interpreter is Trifosa Nzolengwe. On Vital Signs, we'll focus on skin cancer. SunSmart Skin Cancer Awareness Month is observed from the 1st of December 2022 to the 31st of January 2023. Coming up on the program, we'll speak to two cancer or skin cancer survivors, and they share their journey with us. We'll also speak to a dermatologist about skin cancer. We'll speak to a registered fellow in micrographically oriented histographic surgery, in short, Mohs surgery, about how to protect your skin as well as treatment options. And lastly, we'll speak to the services specialist from the Cancer Association of South Africa about how to be SunSmart this summer. Remember that you can be part of the show today by asking the guests that we'll have on any question that you have on your mind by simply sharing your view on what we're discussing. The number to call is 011-714-0677 or 011-714-0678. Also available on social media on Twitter at SABC Vital Signs or Facebook SABC Vital Signs. The show continues after this. Welcome back to Vital Signs. Of course, you're watching a show as we are in the middle of December and here to inform you about everything medical that you need to know. Now, as we observe Skin Cancer Awareness Month and head into hotter summer days, it's important to remember that the role of sunscreen plays in skin cancer prevention. Now, you have a greater chance of surviving the cancer if you also have it detected early. Now, joining us on the show is Sonia Katzenberg as well as Naniki Siboni, who are here to share their journey with us about how they were diagnosed with skin cancer. Thank you so much for both of you for joining us today.
Thank you.
Good. Let's start with you, Naniki. Naniki, here you are. You're a young woman and someone tells you got skin cancer. Before you got that diagnosis, what did you know about skin cancer?
Practically nothing. If I knew anything, it was that cancer as a whole is a white people disease. So if you're going to say skin cancer, you're definitely talking about white people and not people of color.
So what fed into that discussion, that skin cancer, and I guess in your opinion as well, the idea that cancers are generally not diseases of people of color.
Yeah.
So what fed into that?
I think the conversations that we're having in the townships where I grew up, Soweto, we're talking more about HIV and AIDS at the time than we were talking about cancer. If I was hearing a cancer conversation, it was more related to white people who were talking about it, talking about the experiences with it and how it's hereditary. So I never ever experienced, a conversation with somebody of color saying I cancer. No, that never happened.
Now, Sonia, let's talk about the beginning of your journey. So here you are, you've lived a great life, maybe with a little bit of hiccups here and there, and you find out that you get this diagnosis of cancer. How did that affect you?
You never forget the words. When a doctor says to you, you have cancer, something shakes inside of your core, because most of us associate fear with just that one word. And I am the first person in my family to have skin cancer.
Sure.
My mother died of breast cancer, and those are more common. People hear about that all the time. But skin cancer, we don't associate it necessarily with danger and threat to your life. But I came to find out that that was, in fact, a misconception. And that's melanoma, nodular carcinoma, a particular kind of cancer, can in fact kill you. And I was 39 years old, Dr. Musa. I didn't want to hear those words.
Not at all. So I'm sure you have a similar type experience, but a lot of the time when we speak about skin cancer, when everyone or someone discusses cancer with breast, for instance, someone says, examine your breast and find a lump in your breast and therefore go get seen. In your case, Daniki, how did you find this little spot or this big spot that was on your body that made you go, something's not right here?
That's a tricky one because I had the signs and symptoms throughout my life. But when I was, I think, 22, that's when I had the black mole, and that was my melanoma mole. And it was on the lateral side of my leg, and this thing just looked like the most hideous, ugly fly that's just attached to my leg. When you think about it now, well, you know, with understanding, you know, how you actually check for a mole, says, you know your ABCDEs, and sometimes there's a F. Now that I look back on that, I'm like, everything that was pointing to this mole was telling me that I had melanoma. But because I didn't know that previously, there was no way I was going to think that, you know, it was a dangerous thing that was on my leg.
Let's talk about your symptoms, Sonia. What made you see this thing on your body and decide this is not normal?
Well, that's the scary part, is that I had no symptoms, no pain, no discomfort. And if you knew me, you would realize that my body is full of moles, full of moles. So I went for an examination to my doctor because I had flu and my cough wasn't clearing up. And in listening to my lungs with a stethoscope on the back, he noticed one of the many moles would have been, as your other guest has mentioned, noticeable because of the ABCDE acronym that we use to look at moles. And he said to me in passing, think you better go and have this seen to. And I never took it too seriously because, as I say, my body's full of them. So you can have a number of very safe moles and one hiding there. And you don't have pain. It doesn't itch or bleed, in my case. But it had progressed right through a couple of layers of my skin's layers and had become very dangerous. And I wouldn't have known if it hadn't have been found by accident.
Now, we speak about this diagnosis and about how scary it is to receive such a diagnosis. So you're sitting in this doctor's office, you've got the diagnosis, they've done all the investigations that they needed to do. What and how did your life change at that point in time, Naniki?
Like Sonia said, you know, just hearing the words cancer being uttered in your direction is just life-threatening in itself. So when they said, you know, you have stage 3 malignant melanoma, I thought, I don't know what you're talking about. And they proceeded to say, you have skin cancer. And I said, but I'm black. You know, so how in the world does a black person deal with skin cancer? But what happened after that was just trying to, you know, come to terms with what cancer was as a whole, and then diving into what a skin cancer diagnosis would mean for a person like myself, a person of color. I think even doing research after that, I realized that, wait, not a lot of black people were diagnosed with this thing. If there's anybody that I know of is Bob Marley. And I'm like, wait, so it can't be Bob Marley and then me.
It's not just the two of you.
It can't be us. Where's everybody else in between? But it was a truly scary experience. I didn't go to my doctors for about 6 months after they checked on me. I went MIA. I couldn't deal with it. I was so fearful. I really thought my life was over. And I guess at some point I just felt like I'm not going to fight. I would rather this cancer take me because skin cancer seems like the worst thing that could happen to me.
So you disappeared for 6 months. I'm sure your doctor is very unhappy with you at that point in time. But you eventually come back. What was that experience like for you? So the journey to start the treatment, the journey in treatment, and I guess, you know, sitting here today and chatting to us.
The journey coming back to my doctors was triggered by just one day I had had enough. I really had had enough of just being in pain and sorrowful of my life. I was 25 at the time, and I thought, you know, I could still have so much life ahead of me that I was holding myself back, and I thought, I need to do something about it. And I prayed about it that morning. God was like, get in contact with the Champions of Hope group, you know, cancer. So I got in contact with cancer, and cancer said to me, hey, here's a group on Facebook, chat to them. And every single person who was in that group just kept telling me, young one, little one. There's so much life to live. Don't hold on to this thing. Don't let it stop your life. And on the Monday, literally, this was a Friday. On the Monday, I got up, went to the hospital. I've got this. I'm doing this. Doctors are like,
Of course.
Tuesday, they're like, okay, they're with me. I'm like, wait, give me a second. You know, I just needed to gather myself. And on the Wednesday, I came in for my surgery. Friday, I discharged myself because I just couldn't deal with all the stuff. My personal journey with cancer wasn't necessarily about the treatment as a lot of people deal with. It was more a mental and psychological thing. I just wasn't dealing with it well. I really wasn't. And I thought my mental health at the time was just deteriorating each and every single day. So when other people are dealing with, you know, side effects from chemo, I just couldn't deal with my mental state.
Sonia, as we wrap things up, and I think it's the last question that we'll have in our discussion here, how did you deal with everything psychologically? I mean, you already got the diagnosis, and now you need to start the treatment journey, and of course, live a full life after that. How did you take that?
They took out a huge part of my back. So the physical side was already enough to deal with, but that wasn't the worst for me. What happened to me was I got a letter in the post about my life insurance that I had taken out years before. And suddenly there was a surcharge on my life insurance because the expectation was that I wouldn't last another 5 years. And that for me brought the reality home and has made me passionate about making sure that young people really, really understand the danger of a culture that says a particular look is glamorous, even if that means you have to go and spend time on a sunbed, because the immediate reward doesn't let you think about the future
For sure.
terror. And I think that is what the impact has been on me. I'm driven to make sure that young people make more intelligent choices about things that can really take their lives far too soon.
Sonia, I'm going to
That's
have
the
to jump
impact of
in there, but I think there's a big take home that we've gotten out of that let's be more aware of what's going on and let's watch the short-term pleasures for the long-term goal. That was Sonia Katzenberg as well as Naniki Siboni. Thank you so much for joining us. They're skin cancer survivors sharing their journey with us. After the break, we'll speak to Dr. Taryn Jacobs, a dermatologist, about skin cancer. Stay with us. Welcome back to Vital Signs. Now, skin cancer is one of the most common cancers in South Africa, with about 20,000 reported cases every year and 700 deaths. Now, there are two main types of categories in skin cancer, known as melanoma and non-melanoma. And in South Africa, melanoma has been ranked the 5th most preventable cancer in men and 6th most preventable in women. Joining us to discuss skin cancer is dermatologist Dr. Taryn Jacobs. Thank you so much for joining us.
Thank you for having me.
Good. So skin cancer is something a lot of people will say, but no one really cares about skin cancer because there are bigger cancers that we should be worried about. What makes skin cancer such a problematic cancer to deal with?
So generally, the earlier you detect skin cancer, the better. So it's very important to be aware of your risks. And as you correctly mentioned, there are 3 basic types of skin cancer. And it's non-melanoma skin cancer that affects the epidermal cells.
Okay.
The most frequent type of non-melanoma skin cancer is basal cell carcinoma. That affects the lower cells in the epidermis called the basal cells. And it's very common. 80% of non-melanoma skin cancers are basal cell carcinomas. So these are very slowly growing. They hardly ever metastasize, but they can become locally destructive. Then the next part of non-melanoma skin cancer are squamous cell carcinomas. This is the intermediate type, affecting the squamous cells higher up, flattened cells in the skin. And if you leave it untreated, then they can become invasive and grow deeper within the layers of the skin. Very uncommon, but they can also spread to other parts of the body. And then something that you really do want to detect very early is, as we've heard, melanoma. And this affects the pigment cells, the melanocytes in the skin. It is also the most dangerous because it can have the potential to metastasize. And the most important prognostic factor is how the vertical tumor depth is, how deep it is. So that means to say how well you're going to do as a patient is dependent on your tumor thickness. If it's just very superficial, 1 millimeter, 95% of people are going to do very well and they're going to survive. But if it has gone down to 4 millimeters, the survival rate drops to about 50%.
Sure.
So, just a couple of millimeters difference, but really a significant difference in terms of morbidity and even mortality. And it's for that reason, it's critical to diagnose it early.
Now, you spoke about risk factors. So are there things that I should be worried about if I potentially think that I could have skin cancer? What are the risk factors?
So the predominant cause of non-melanoma and melanoma skin cancer is UV exposure from the sun. And there are different types of UV exposure. For basal cell carcinoma, we think it's more intense, intermittent exposure and childhood exposure.
So does that mean I was a child that played in the sun too much without a hat and sunscreen?
Precisely that,
Okay.
yes. So all of it adds up. But it's also sunburns in a way. So also people who are working indoors, perhaps in the week, but then over the weekends, having a lot of sun exposure, vacationing, even that adds up. For squamous cell carcinomas, it's more the cumulative, lifelong, continuous sun damage and UV exposure. For melanoma, it's a bit of both, but it's mostly intermittent acute, but also sunburns. In fact, if you've had more than 5 blistering severe sunburns before the age of 20, you can increase your risk of melanoma by 80%. Then, of course, there's other factors, personal factors, like people having lightly pigmented skin with a tendency to burn, red hair. That can all increase your risk for skin cancers. And then another factor I'd mention is immunosuppression, people with weakened immune systems. In South Africa, we have one of the largest HIV epidemics, and HIV infection can also increase your risk of a lot of cancers, but particularly for squamous cell carcinoma of the skin as well.
Now, the discussion, and a lot of people will use it, I'm sure I've said it a few times in the past, is that I'm darker skinned, so this stuff doesn't really matter to me because what is the chance that I'll get skin cancer?
Right.
Is skin cancer, I mean, you've mentioned that fairer skin obviously becomes a risk factor in this case, but are people with darker skin more protected, and are their chances of getting skin cancer lower than those that are more fairer skinned?
Right, so there is this misperception and belief that having darker skin offers this full protection from skin cancer, but skin cancer doesn't discriminate. Everyone is at risk. Skin cancer is less prevalent in skin of color and non-Caucasian skin types, but when it does occur, it often occurs at a later stage, and this results in a poorer prognosis. And there are a number of reasons why that happens. Firstly, as we touched on previously, there's a lack of public awareness of skin cancer and skin of color. And then from the perspective of healthcare workers, there's also this lower index of suspicion in diagnosing skin cancer and skin of color. Another issue is that when it occurs, the locations are sometimes different. So it occurs in skin of color on non-sun exposed areas, and that can make detection quite difficult. For example, with melanoma, the most common melanoma in skin of color is on the lower extremities, as we've heard, particularly the soles of the feet. And that is an aggressive form of melanoma called acral lentiginous melanoma.
And generally with these then darker skinned people, like you've mentioned, makes it difficult to detect because you've darker skin, you're not necessarily noting all the moles and things such as that. So what should people look out for in terms of doing examinations on the skin and looking for things that could potentially become cancerous?
So I think let's talk about the different types of skin cancer because they do present differently. Just basal cell carcinomas. Typically the story is it's a spot that's just not healing. So that can look like a flesh-colored rounded bump or growth, can sometimes just be a pink scaly patch. Squamous cell carcinomas, that's sometimes a red patch appearing on the skin, even a warty, thickened skin, and an open sore, and often they crust over and bleed. And then for melanoma, which we've spoken a lot about now, and there were some really good infographics there that I thought, let me just explain about. The best way to detect melanoma is the ABCDE acronym. So as we saw, asymmetry, that's apparent if one side of the mole is different to the other. Look at the borders. Are they regular? Is the color even? D is for diameter bigger than 6 millimeters.
Okay.
And E is the most important, which is evolving change. If you notice a mole or a spot is changing over time in size, shape, or color, that could indicate that something's off. But in addition to those 5 parameters, there's also the ugly duckling sign.
Okay.
So that is to say that if you have a spot or a mole that looks different from your other spots and moles, pay attention to that. It can be darker, it can be substantially different in size. If you see any of those changes, see a dermatologist.
So let's speak about moles and freckles and things such as that. Now, a lot of people have got moles, a lot of people have got freckles, a lot of people have had, previous injuries and have darker scars on their bodies. Should these worry the people that have them, and how often should they get checked out? And in terms of record keeping, let me use that as a word, to say, how do I assess my spots to say this one has grown or this one has gotten bigger or smaller?
So I advise my patients to do skin checks, and it's important to your self-skin checks, in other words. So it's important to check your own skin thoroughly, set aside that time once a month. And how you do that, it's best done in a well-lit room, stand in front of a full-length mirror, and have a handheld mirror to check the back.
Okay.
And it is basically a head-to-toe check. So you're checking front, back, lifting your arms to check the sides of the body. Don't forget to check underneath the feet, as we've mentioned, in between the toes, part your hair to see your neck. So do check it out. And if there's anything concerning, that is when you want to actually see a dermatologist. There are some risk factors to be aware of on when to see a dermatologist. And I think that's the most important part of prevention. Know and understand your risk factors. So there are some questions you can ask yourself. Have I ever been badly burnt? Does my skin type burn or tan?
So let's take a break there.
Yeah.
What does badly burnt mean? So if, for instance, I go out swimming, I don't use any sunscreen, I don't have a hat on, and I spend the whole day in the sun, and I get home and my face is a little bit warm and a little bit sensitive, does that mean I've been sunburnt, or how do I gauge what sunburn means?
So sunburn is actually very hard to appreciate in skin of color. So you may not appreciate that redness and erythema on the skin. Easily done in lightly pigmented skin. But it sometimes appears darker. So sunburn is that severe, sometimes blistering sunburns. That is more of the problem. And the melanoma quotes, they all work with those blistering sunburns. So and then you can visibly see the severity when you see the blisters.
Now, let's talk about other things that could contribute to people getting skin cancers. Tanning beds and things such as that. Are these problems that we should be on the lookout for? Or is it safe to go get a tan once a month and, get myself a little bit more color?
Right, very important question. We are seeing a rise in skin cancer in younger people, particularly women and younger women. And the reason why, and one of the major contributing factors, is thought to be the use of tanning beds. So a tan is basically the skin's mechanism of protecting you from UV damage. And what happens is your pigment cells make more melanin to absorb that UV radiation. So repeating this over and over years, it can cause cellular mutations, and this can ultimately lead to skin cancer. So tans are really never justified. They're actually quite harmful. And what people are unaware about is that tanning beds are not safer than the sun. In fact, one indoor tanning session can increase your risk of skin cancer by 67%.
Sure.
So yeah, science tells us there's really no such thing as a safe tan.
So those are tanning beds. Is there a safe tan in the sun on holiday, as people pack up their vehicles and head to the coast this December to go lie on the beach on a day just to get a bit of color on them? Is that more advised versus getting a tanning bed?
It's not recommended because it does build up over time, all of that exposure. So what I tell my patients is, if you really want that bronze look, the healthy glow, use a self-tanner. That is the safest option.
Let's talk about preventing skin cancers now. What steps should one take to ensure that they are not at risk or don't increase the risk of them getting skin cancers?
Right, so I think I touched on, the most important step is to know your individual risk factors. And we spoke about the burning, the skin type, outdoor exposure and all of that. And then it would be a really good idea to see a dermatologist. Dermatologists can do a thorough skin check. We can check individual concerning spots and moles with what is called a dermatoscope. So effectively, it's like a large magnifying glass, and that can give a really clearer and closer look of skin lesions. And for selected individuals, there's also mole mapping, which is digital imaging that allows you to monitor for changes. So it keeps a record of all the moles and spots that you have. And the second step, I'd say, is we know that UV radiation is the most preventable risk factor.
Okay.
And as South Africans, you mentioned, we love to be outside, we want to enjoy our beautiful country, but we also need to be mindful of being safe in the sun and protecting our skin. So that is to say that sunscreen is recommended for prolonged outdoor exposure, but also for everyday activities, because, as I mentioned, the exposure builds up over time. So who should use sunscreen? You know, the short answer is everyone. Yes, darker skin does give some protection, but it's not completely immune to the damaging effects of the sun.
So how do we pick the sunscreen? Now, there's a lot of discussion, a lot of confusion. You go into the shop and you stand in front of all these sunscreen products, and this one is saying 30, this one's saying 60, this one's saying 50.
Right.
Which sunscreen should you use for your, I guess, skin tone?
So the best sunscreen is the sunscreen that looks good on your skin, that you want to use. It blends well into your skin because it doesn't work if it's just standing in the bottle. So it's something that you want to use. But my general recommendation with regards to SPF is a minimum SPF of 30. Look for the words broad spectrum, meaning it covers UVA rays and UVB rays. And I think it's important to also mention that sunscreen is just one component of a sun protection strategy.
Okay.
It goes hand in hand with physical means of blocking the sun. So using wide-brimmed hats, sunglasses, sun protective clothing. And then the third pillar of a sun protection strategy is seeking shade. So if you're going to be spending time outdoors, a really good rule of thumb is the shadow rule. And that is to say that if your shadow is shorter than you are, it's time to seek shade. So they all work together.
So lastly, back on the sunscreen once again, is an SPF 80 or 60 better than an SPF 30?
So that is confusing for many people. There's only a minimal amount of difference between, for example, an SPF 30 and an SPF 50. SPF 30 blocks out 97% of UVB rays and SPF 50, 98%. But really, the higher SPF is more forgiving because studies show us that the general population only applies about 30 to 50% of what they need to be protected. So in that way, it just covers you a little bit more. So as a good visual, how much sunscreen to use, it is 2 tablespoons or a shot glass for your whole body, and that equates to about a teaspoon for your face and neck. So you have to use legitimate amounts of sunscreen in order for it to confer that protection.
And how long it lasts, is that important as well? Can I apply sunscreen at 8 in the morning and I'm safe at 5 o'clock still?
My recommendation is that if you're going to be outside, then you need to apply every 2 to 3 hours. And if you're going to be swimming, you want to look for a very water-resistant type of sunscreen.
Lovely. Thank you so much, Dr. Jacobs, for joining us today and talking us through skin cancer and all the things that you need to do to make sure that you're protected from the sun this festive season. After the break, we'll speak to Dr. Tshepo Mokoena, a qualified Mohs surgeon, of course, and he is a fellow currently, and we'll talk about how to protect your skin and, of course, all the treatment options that exist. Welcome back to Vital Science. Now, early detection of skin cancer is key to improve the survival outcomes. Anyone, regardless of skin tone, can get skin cancer, as we've heard. And South Africa has a high rate of skin cancer, and most skin cancers are treatable and preventable. Now, we continue our talk, and now we've got Dr. Tshepo Mokoena, a qualified Mohs surgeon. Thank you so much for joining us.
Thanks, Dr. Musa.
Good. So, you are a Mohs surgeon. What does that even mean?
So, Mohs surgery. So, in short, Mohs surgery is a precise, accurate technique and very specific that we embark on to cure skin cancers. It was actually founded by Robert Mohs about many years ago. And since then, it has been modified to what it is now to date. As a matter of fact, it is almost a gold standard for treatment of skin cancers. So if you go throughout the history and throughout the modification of this technique, the Europeans have been leading, the Americans have been leading, and Africa was almost lagging behind. And almost recently, our center probably is the only center in Africa that's doing Mohs surgery every day. And we've recently published over 1,500 cases to date that we've treated with a very good outcome and less than 2% recurrence rates. So most surgery, to sum it up in short, is a very precise technique whereby a surgeon, cuts the sick tissue, sparing the normal tissue, and removing the tissue or the abnormal cancer, macroscopically dissecting and clearing the margins and making sure that the cancer is cleared. So by the end of the day, the patient comes in the morning, at the end of the afternoon, the cancer is cleared with very, very minimal recurrence rates.
Sure.
If you compare that to old method of doing things, whereby a surgeon will just cut, send you home, 2 weeks later you're called to come back because the cancer is not cleared. Cut again, and you come back again, and so on, and the cancer keeps on recurring. And patients then had over 65% recurrence rates compared to now, which is less than 2%, which is a very great technique. And by the way, we look at the margins of the cancer and we clear the margins of the cancer. So
what does that mean? So if Musa has just walked into your rooms, I was told that I was skin cancer because I followed the ABCDEs.
Correct.
I looked, it's red, it's got abnormal borders and all those sort of things. It occasionally bleeds. You guys make the diagnosis after you've checked it out.
Yep.
Then they refer me to you, Dr. Mukwena, to say that Dr. Mukwena must cut this thing out for me.
Correct.
When I come to you, what exactly are you going to be doing?
Good. So when you come into the practice, firstly, we admit you. You go into theatre. We give you some obvious local anesthesia to numb the area and to minimize the pain. Basically, cut the area as minimal as we can. Go into the theatre, and into the theatre, if you remember, the old method of doing things was called a sampling method. Now, consider a loaf of bread. If you've got a loaf of bread, what used to be done then was to look at the first slice of bread, the second slice of bread, and pull the middle. If you do that and there's no cancer in between the slices, you would normally
say there's no
it's clear, it's not cancer. But now, throughout the years, science has shown that most of these cancers, as Dr. Taryn Jacobs has said, has been missed because you've got different types of cancers. Some grow in like an octopus, some spread like a starfish, and they are missed if you do that method. So what we do, we take the same loaf of bread, put it on the table, check around the slices of bread, underneath the slice of bread, in between the slices, and the radius around the slice. So that is a perfection. So you actually removing the cancer as you look at it, and that gives you a proper clearance margin rates, and it gives you a better cure rate. And if you look at all the literature studies that have come out now, this is probably the gold standard method of treating the skin cancers.
Before we continue and talk about treatments, I know Christine's on the line, and please just hold on a little bit longer. Before we get to treatments, I want to talk about the skin just in general. Why is the skin so important?
Well, one of the largest organs of the body, we know that. Very important. And the most important functions of the skin include communication, thermoregulation, hormone interaction with the environment, vitamin D production, protection, and so on and so on. And that's why the skin is so important. It's one of the most important vital organs, the largest organ of the body. And that is why it's so important. And if you look at, as Dr. Taryn has indicated to earlier on, different physiopathic skin types from type 1 to type 7, all of this presents with different type of disease, and especially in relation to non-melanoma and melanoma skin cancers.
Okay.
In physiopathic skin type 3 to type 6, as Dr. Taryn has also alluded to, that once these patients present, the darker skin types that is, once these patients present to us, mostly the presentation is late, the diseases have been missed, and throughout history, as you know, as you studied, all our medical textbooks, mostly when you do any other skin, the presentation there was only mainly the physiopathic skin type 1 to 3.
So the fairer skin types.
The fairer skin types.
Yes.
And the training in our skin types have been almost delayed by a decade. And it's a good thing now that in the current 21st century, we've improved the learning and to the fellows and so on. And this has also brought lots of education to teach people about the importance of the skin as an organ, and that it should not just be neglected as part of, by one of the organs that's just there.
It's
anyway.
just there.
Yeah.
All right. So, Christine, I know you've been holding for quite some time. What is your question for us this morning? Good morning.
Okay, thank you. You see, we got low shedding, so I'm better to hear you.
No problem. What's your question for us this morning?
I've got skin cancer on my arms and my face.
Okay.
I had my face burnt and my arms burnt about 11 years ago.
Christine?
Yeah?
Yes, so we're listening. What's the rest of your question?
Oh, I can't hear you.
Okay.
I think you better, I'll call you tomorrow when there's no load shedding, because I think the load shedding is affecting the phone.
All right. Sorry about that, Christine, but I think we'll catch the drift of your question, and I'm sure you will get that question answered. Keep listening on the TV. That was Christine from KZN. So, load shedding creating many problems, isn't it? So, let's talk about people that have got skin cancer. Now, there are a number of treatment options, like you've mentioned, that are available. There's the Mohs surgery, which is a very, very pinpoint type surgery where you do basically a 360 look at the whole cancer, encapsulate it, and pull the whole thing out. Are there other treatment options that are available to people that have skin cancer?
Yes, thank you very much, Musa. I think, as Christina's question, just to address a few things. One, she needs to be examined by a dermatologist.
Okay.
We need to grade the type of the cancer and proper diagnosis and ascertain what type of cancer it is. Well, depending on the grades of the cancer, as Dr. Taryn has just said, one, we did discuss surgery. Cryosurgery is part of the treatment of cancer.
What does that mean?
Well, we use liquid nitrogen. I mean, liquid nitrogen has now been made famous by chefs now, cooking and other things. But we literally use it for treating skin cancers.
Okay.
And we usually, as Christina just said, we burn it. It's not that we burn per se, but we literally freeze the area.
Okay.
And there's a particular way in which the lesion must be frozen.
Okay.
That also results in necrosis of the tissue. Then you kill the damaged DNA, which has been damaged by the radiation.
Okay.
And then you get development of new tissue afterwards. And that probably resolves the cancer.
Okay.
But that depends on the depth of the lesion, the grade of the cancer, and the type of the cancer.
Okay.
So, and then the third thing we discussed, which is one of the gold standard therapy, which is Mohs surgery. Other therapies include chemotherapy. I will not go deeper into that, but we've got different types of chemotherapy. Chemotherapy means either you can either drink or apply on the skin or on the cancer itself. And this results in one, either we accelerate the immune system to function and to recognize the cancer cells and destroy them, or we suppress the immune system so that the cancer cells can die and can be recognized by the treatment as well, which is immunotherapy. And we've got targeted therapy, which is radionuclide targeted therapy, which is also a new, not a new per se, but it's 21st century advanced medicine. Our greatest author and scholar, Professor Max Atech, has written extensively on this, which is a precise method of treatment of cancer, which is personalized for elderly patients who cannot go to surgery. You've got other underlying comorbid conditions, so they cannot be eligible for surgery. They've got, and the tumor is too big. They don't want to do surgery, so we can do this targeted radionuclide therapy. So in essence, that's all the most forms of therapy that we have for the treatment of skin cancer. And addressing, the question of Christine, that so we need to grade the cancer. She needs to be seen whether the cancer is operable or inoperable. And from all these groups of therapies that we've mentioned, that's how we can treat the therapies. She needs to remember that she may not or she must not delay the treatment, because the further you delay, as Dr. Taryn Jacobs has just indicated earlier on, this can cause complications. You can have this cancer cell spread into other organs, and that's very detrimental and can cause and provide and results in a very poor prognosis.
Let's talk about this idea of remission, or this idea of the cancer returning. When you have a skin cancer, are there chances that this cancer may come back to the same site or to a different area in the body?
Yes, it can. As I've mentioned on the therapies that we have to date, scientifically, we can get, especially with most micrographic surgery, we get close to about over 95% cure rates with less than 5% recurrences, which is a very good form of therapy. But there are very advanced stages of cancers, which after different forms of therapy, it can recur to the very same area and on the very same affected area. So there is a chance that it can recur, and that the patient may require further therapies or combination of therapies of all those different types of therapies that we discussed in order to assist in the treatment, including radiation therapy as well, to treat the cancer cells.
And lastly, before you go off, what are the important things that everyone at home needs to remember with respect to skin cancer? What must we be on the lookout for? Is it the ABCs that we need to follow? Do we need to do skin exams? What should we be doing?
I think you've summed it all. Early detection is very important. Early detection. We should be very, I always tell my patients, a self-skin examination keeps a dermatologist away. So if you present early, self-examination, head to toe, close the room, examine yourself from head to toe, in between the thighs and in between the gluteal folds, and examine yourself. Very important to check for anything that grows, anything that was not there, anything that was there and disappears. you should also be able to recognize your skin and present yourself early to the dermatologist. Yeah.
Well, thank you so much, Doc, for joining us today and taking us through all the treatment options that will be available if you find yourself having received that diagnosis of skin cancer. That's Dr. Tsepo Mokoena, a fellow, no, not a fellow anymore, a specialist Mohs surgeon. And of course, that includes them cutting out all those skin cancers that exist. After the break, we'll speak to Olivia, who is a services specialist from the Cancer Association of South Africa, about how to be SunSmart this summer. Welcome back to Vital Signs. Now, the Cancer Association of South Africa runs a SunSmart campaign every year from December to January to remind all South Africans to be SunSmart throughout the year and especially during summer. Joining us on the show is Olivia Kerr-Lewis, who is a services specialist from the Cancer Association of South Africa. Tell us about how we can be SunSmart this summer. Thank you so much for joining us.
Thank you so much for having us here. Yes, it's all about being SunSmart. SunSmart, we must avoid the sun between 10 and 4 in the afternoon. Avoid sunbeds. We've heard a lot about the sunbeds. We need to wear protective clothing. We need to apply our sunscreen and just, protect yourself from not overexposure to the sun, because as Terence said, it builds up over time.
So what's the aim of this campaign? Like, I get that it's summer and that, it gets a little bit hotter and people go to the beach and want to have fun and don't want to wear hats and, all that sort of thing. But what's the aim of the campaign?
To create awareness, because South Africans, we love the sun. We love being outside. We love playing our sport. We love the beach. We love going fishing. And, we have to protect ourselves. So it's just to bring that awareness that each one of us need to take responsibility. And skin cancer, cancer that's caused by the sun there's no discrimination. Anybody, any race or creed, we all can have, get skin cancer.
Now, earlier on, we heard from one of the guests that was telling their story and their journey on, with cancer. The idea that, they reached out and they were able to get support from a group. What role does cancer play, the organization, with respect to helping people out that have sun cancer or skin cancer?
Well, first of all, we create the awareness. And if somebody is diagnosed with skin cancer, they can contact us and then we are there to walk the road with them. To the journey, be it if they're going just through surgery or radiation or chemotherapy, and just to give them the knowledge of, what to expect and that they're not alone. We have support groups, we have online support groups. COVID has taught us a lot of things of how we can work more via the Facebook and all that type of thing. So, we are really, just creating awareness and supporting people going through their treatment. And sometimes they don't have the answers to it. And then they're afraid of what the treatment entails. And just to, give them that information and meet them at their point of need.
What have you found to be one of the big reasons why people, like our first guest today, said, they disappear, where you get this diagnosis and there you're off. You're like, nope, I don't want to chat to any doctors. This might be the end of my life, so I'm just going to go live the best life that I can. What feeds into that?
I think it's fear. It's the fear of the unknown. When you don't have the information, when you don't know exactly what is your treatment going to entail, if nobody has spoken to you or given you the necessary support or information, then you think, well, let's just run away. Let's not... if I just ignore it, or if I'm like an ostrich and I put my head in the sand, it will just go away. So therefore, it's meeting the people at their point of need and giving them that vital information that they need to go through this journey of having their treatment done. And it's that access to treatment and the support which is so vital to people that have been diagnosed with skin cancer.
Now, education plays a very big role in, diagnosis, but more importantly, prevention of many of the cancers that we do find ourselves in. How important should disseminating this information be? So I get that we've got awareness campaigns like the one that we have for this month. How important are awareness campaigns?
Awareness campaigns are vital, and really starting from youngsters, especially if we try and teach them when we reach them at school level. And from little, in primary school, because to teach them how to protect themselves, that, just a cap doesn't protect their neck, doesn't protect their ears, that type of thing, of wearing the sunscreen, of playing in the shade, of, reapplying sunscreen, and then the dangers of the sun, because as Terence said often, it's an accumulative, this accumulative curve that eventually predisposes them to getting skin cancer. So besides the awareness, it's just trying to bring it out as broad as possible to the schools, to the youngsters, and it's our youngsters, because 80% of skin cancers can be taken back to a sun-damaged skin before the age of 18.
Sure. And the aim, of all these campaigns is to educate, to make sure that everyone's aware of all the things that they need to do to prevent, but also identify with all the ABCs and things like that we've mentioned.
Yes, they must know. They must know the ABCs. They must know what the A stands. They must know how to do their body checks. They must know how to take responsibility for their body. And if they do see a mole that is a little bit different, or it's changing, or it's evolving, not ignore it. Go and have it checked out, because early diagnosis leads to a much better prognosis. So that awareness, and not just thinking, oh, well, if I just ignore it, it'll go away. It won't go away. We need to take responsibility for our bodies.
Any points of information or places that people can find you over the festive season where these awareness campaigns will be happening?
Well, on the beaches, we have the spot check, so we try and, be where people are now going to be sun worshippers and being on holiday and that. But then on our website, we've got a lot of information on our website. We've got a lot of, things to go and look at, how to protect yourselves, and, and to reach out to us if they need, and fact sheets or everything about skin cancer. But toll-free number, they can phone that, and they will then get the necessary support, either through our telecounselling line. If they have been diagnosed with cancer, they can then get a counsellor that can speak them through that, so that fear is removed.
And that's a big, big thing, the removal of that fear, so that people are able to get the treatment early enough and don't run off and find themselves, having complicated their disease.
Absolutely. You can remove that fear and just give them the knowledge to know what the road ahead is. I think we've got 90% of the battle.
Lovely. Thank you so much for joining us today and coming out to tell us what cancer is all about, especially with the SunSmart campaign that is currently happening, of course, and will continue throughout the rest of the festive season until the end of January. Go out to all those points and, of course, reach out to them on their websites and, of course, telephonically if you have been diagnosed, or just looking for points of information so that you're more informed. Throughout the show, we've shown you those graphics of all the things that you can do, with respect to doing all those body checks, assessing the moles that you have on your body, making sure that you're able to assess them and look for the asymmetry, look for the color changes, see if it does bleed, and all those additional things that we've highlighted today, so that you're more aware of the spots not only on your body but are able to assist anyone else that you have in your life, a family member, and you can check out all those moles and spots to ensure that they do not have those early stages of that skin cancer. And of course, all the important other things that you need to do to make sure that you are sun safe, wearing your hat, using your sunscreen, and making sure that you stay in the shade and don't find yourself in the sun between those hours that have been mentioned. Thank you to all the guests that participate in today's show, and we hope that you take something away from this one. From us here at the Vital Signs team, thank you so much for joining us. I'm Dr. Mosam Tombeni. Until next time.